This is a tips and tricks video on accessing the PDMP or Prescription Drug Monitoring Program within Cerner. In the past, you may have accessed the PDMP database via the prescriber web portal that you see here. That functionality has now been integrated into Cerner and will be linked to the patient within their chart. The database link will be located within one of the chart tabs referred to as MPages. In this case, as in most instances, it is located in the Manage tab, where you will see Opioid Review in the list on the left of the screen. Left-clicking that item will launch into the PDMP window. You can then left-click View Report to access the database. Within the PDMP window, you will see patient-specific information that includes any state records or identifications linked to the patient, clinical risk indicators identified by the database, and overdose risk indicator scores. Below this is a variety of graphical representations, including a histogram of recent controlled substance prescriptions, which can be selected or deselected to view particular controlled substance types, or hovered over to see specific recent prescriptions. There is also a graph of recent controlled substance prescriptions portrayed in dosing equivalents, in this case, morphine equivalents. Next is the individual prescription data that includes individual prescriptions, the quantity prescribed, the dates both prescribed and filled, and the prescriber of each medication. Finally, a list of prescribers who have written controlled substance prescriptions for the patient and the pharmacies at which those prescriptions have been filled are included at the bottom of the report. After reviewing the PDMP report, you should left-click the Mark as Reviewed button. This will add a timestamp in the chart that you reviewed the information. Finally, you will note headers at the top of the Cerner tab regarding recent controlled substance prescriptions. Please note that this data only includes prescriptions that originate within Cerner, so that information may not be accurate. For further assistance, contact IS Provider Support at 843-212-8000 or email the IS Training Team at harbortraining@rsfh.com.